Hi. As with other videos, I'm starting this video with reinforcing that masks are mandatory now and will be mandatory in the fall. I realize this will be different and necessary. As the chair of the Faculty Senate, Dr. Megan Rosenthal, observed recently, this virus has fundamentally shifted the way that we offer education. I agree. It's also fundamentally shifted the way we interact, the way that we operate, and the way that we work. The public health guidance and protocols are our new foundation for our operations and have been implemented to prevent the spread of the virus between people. The protocols are based on public health guidance that takes a layered approach to each area, using barriers, distancing, and hygiene, and decreasing the likelihood that someone with COVID is present. We're also keeping a close eye on the state and local orders to make sure that our protocols are in line with those. I want to thank the deans, chairs, and faculty for their hard work to determine what courses can still be taught in the classrooms and instructional spaces, given that our classroom capacity has been dramatically reduced. We appreciate your use of the considerations we developed together to guide those decisions. Please remember that face masks or cloth face coverings are required in indoor spaces. The effectiveness of these were supported in a recent CDC report, which published a convincing case study on 2 hairstylists who, with COVID-19 symptoms, continued to work while symptomatic and subsequently tested positive for COVID-19. These hairstylists interacted while symptomatic in close contact with 139 clients. Both stylists and clients were wearing masks. All tested clients were negative, and not a single client developed symptoms. Think about that. 2 COVID-19 positive hairstylists working in close proximity to 139 clients. Not a single one tested positive or developed symptoms. Masks work. There are other studies that show the effectiveness of masks and cloth face coverings as well, and we've implemented many other protocols and parameters to add additional layers of protection in specific areas. There's still a lot of work to do. Efforts are still underway to finalize plans for expanded testing capabilities, policies to hold people accountable if people don't adhere to the protocols, scale back strategies and criteria for making those decisions, additional protocols in academic spaces, housing, fraternity and sorority life, events, student union, the contact tracing team that will facilitate the activities of contact tracing, purchases of equipment, classroom equipment, microphones, cleaning supplies, and contact tracing software, intellectual property guidance around recordings, the public health campaign, which will begin closer to the end of the month, adjustments to transportation, the necessary signage for the fall, and classrooms that will enable students to study as the library's capacity will be cut back. I also want to thank the faculty for their hard work in the spring to shift formats and the work that they're putting into courses for the fall. The student evaluations of teaching from the spring, which had a 78% response rate, revealed that faculty had the highest average rating compared to the last 6 years on 3 parameters: instructors' overall performance, preparedness of the instructor, and the rating of whether the lectures and activities facilitated learning. Faculty should be proud of these student ratings, given how disruptive this semester was. We know that this is different, and we're doing everything we can to keep teaching so students can keep learning. And with an instructor assigned to every single section in the fall, regardless of the format, I am confident this fall will be an outstanding learning experience. I want to close by sharing a perspective that I gained from watching reports of healthcare workers caring for COVID patients in the hospital room, where workers are covered with protective equipment. They can be seen swarming around the patient, actively working to provide care. Their faces, heads, and identifiable features are all covered by PPE, yet they have hung pictures of themselves around their necks. They don't do this to make their job easier. They don't do it for their convenience. They do it because they want the patient to see a human face while they struggle to fight off the virus. They want to connect with the person they're helping. I was struck by this act of kindness and humanity. The notion that even in the most severe of circumstances, we still need to connect as humans, person to person. We are navigating extraordinary times. It is requiring us to be creative, resourceful, and innovative. And our data shows that you, the faculty, met that challenge in the spring with incredible success. And all while juggling childcare, elder care, worry, fear, and grief. We're exhausted, and yet we still have a lot to do. And we do it because education is important. Creating and discovering and serving our state are important, and connecting as people is still important. The workload has been compared to a marathon, and we are not even halfway through. Keep up the good work. I'll talk with you again soon.